Stand by. I can count down, yes. All right, I won't count. Just tell me when. Relax.
Well, good morning and welcome to this and the latest in the series of forums that we are putting together, in which we bring local medical experts to talk with you. This one is a little bit different because previously what we sought to do is to have the experts talk about specific areas and to share their perspectives with you on those areas and to be questioned by the media. But we've been getting so many questions from average people that we thought that today we would do things differently. And that is why we have two doctors here with us today. And we're going to give you the opportunity to talk with them, to ask them questions as you continue to be in quarantine, in isolation, you're recovering after you've had COVID. There are several challenges that people have out there. And that is why we have brought these two doctors for you to send your questions to them. You can do so by sending your messages and your questions to this number as WhatsApps or WhatsApp messages, 256 1023. So if you have a question for the two doctors that we have here, then send that question to me via WhatsApp using the number 256 1023. Who do we have with us? From the Public Health Administration section in Barbados, we have Senior Medical Officer of Health, Dr. Arthur Phillips. And with him is a lecturer in public health at the University of the West Indies, who's also a general practitioner and a general palliative care provider. She is Dr. Natalie Greaves. So let's come first of all to you, Dr. Arthur Phillips. From where you sit, what are some of the common questions that people are posing to you and to the other doctors that work in the system? Welcome.
Morning, David, and thanks for this opportunity to be part of this program. I think it's important for us to have these kinds of opportunities for persons to ask questions and to hear information. Sometimes it's information presented in a different way. Sometimes it is new information, but I think it's important for people to get clarity in terms of what living with COVID means. We get all kinds of questions. I think at the moment, given what's happening in Barbados, and I'll speak about that for a little bit, but at the moment, a lot of those questions relate to quarantine and isolation, return to work, coping with life after COVID. So I'm assuming that we may get some of those kinds of questions coming up this morning, given the frequency with which we've been hearing those kinds of questions recently. Just to give a little flavor of context in terms of where we are, I know people have been seeing the dashboard, but I just want to say that in terms of what's been happening and what's happening currently in Barbados with COVID, we are still seeing a very high level of transmission, and that level is continuing to increase. We would normally define more than 500 cases per 100,000 population as a very high level. People may remember back in January and March, we would have spoken to the idea of 25 cases per 100,000 as a threshold that we were aiming for to get below. And we have been, for the past few days, at above 16, above 1,700 cases per 100,000 population. And of course, we've established that Delta, the highly transmissible variant, is circulating in Barbados. On the dashboard, people would see reference to the percentage of the total population that's vaccinated. It's about 47% or so as of the 1st of November, and about 55% of the eligible population. So that just sort of gives us a flavor of where we are and what's happening. So in terms of some of the specific questions that we would want to speak to, because we're hearing them commonly, one of the first ones that I would want to bring up and to address is around the issue of the workplace setting and persons going back to work after having been in quarantine or after having been in isolation. We would have produced workplace guidance around the beginning of September, and we would have recently updated that to provide guidance to workplaces and to individuals who are in workplaces so that they understand some of the issues. Because the reality is, with the numbers that are on the ground, one, and two, with the fact that we've been managing this for some time, we felt it was important to put information in the public domain to empower individuals, to empower employers, to empower workplaces to better deal with COVID, particularly in the recent update around the issue of return to work, of those who have been in isolation and those who've been in quarantine. So I'd want to address the issue of those who've been in isolation first. And I want to make clear, because this is something that we're hearing coming up quite often, that employers are asking for a negative COVID test for someone who's been cleared, who's been discharged from isolation to return to work. And this is not supported. This is not appropriate, given that someone who's been positive for COVID can continue to shed. They're not infectious, but they can continue to test positive for a period of time, sometimes up to 3 months. And therefore, employers need to allow persons who have been discharged, who have been cleared, who have been identified as being non-infectious to return to work without a test. And we've also written consideration of this into the framework for the safe zones as well, where there would be a period of at least a month before these persons then get into the routine of being tested to be cleared, if then depending on whether they're vaccinated or not. In terms of those who have been in quarantine, the situation is, once a person no longer is having a known contact or risk of exposure, then they need to quarantine for at least 5 days and test as negative before being cleared to return to work. I think these two things are very important, because I think workers sometimes have questions about these, and employers who may not be clear can sometimes be asking questions or giving guidance that is not quite in line with what we are recommending and what we would expect. So those are the first two things that I would want to speak to, and that I would hope that all employers and employees are in line with. As we would have done on the previous occasion, we would have shared the workplace guidance document with the Ministry of Labour. We would have shared it with GIS as well. And we will, in conjunction with Ministry of Labour, be engaging with the employers' associations to make sure that they are aware of and fully understand the guidance that we have in place for these two situations, return to work in terms of those who've been in isolation and return to work in terms of those who have been in quarantine. So I'll stop there for now, but I just wanted to flag those two out of the blocks, given the frequency with which, one, we get queries, or two, we hear of situations that are not in line with what we would want.
Thank you, Dr. Phillips. And Dr. Greaves, now, from your vantage point as a general practitioner and a general palliative care provider, what do you see as the issues and the concerns that need to be addressed from members of the public?
So thanks again, David, for the opportunity to speak on this platform. And thanks, Arthur, for the previous contributions. From where I sit, I think people are fundamentally concerned about how they can prevent transmission from, if they're COVID positive, if they're living in the same household, and there's somebody who is negative, et cetera, how do they prevent transmission to that individual? I think in addition to that, if you are COVID positive and you are under treatment, how do you maximize your health? And if you are in your recovery period, how do you optimize your health? The other question that persons seem to be still struggling with, and it's a bit concerning to me, really revolves around if the non-pharmaceutical interventions help. Is there still a role for mask wearing? Is there still a role for temperature screening when you go to the grocery? Is there still a role for this hand sanitizer system that we have? So I just want to start with some of the fundamentals that we should know. And I'm responding to some of the things that I've seen on social media that suggest that because the evidence is evolving, people are being quote unquote duped. So I just want to highlight a couple of things. We know that coronavirus exists. It's amazing to me that still persons are still saying that COVID is not real, and that it's essentially a whole hoax. That's not the case. I think those persons who have been ill can attest to that, and the public health practitioners and the persons at Harrison Point, and just the global evidence base would let everyone know that we have to put that kind of argument aside now and accept that this is a condition, and this is a condition that needs to be treated aggressively and managed at a population level and an individual level as well. So I would want to use this opportunity to implore persons to take a moment of pause. Sometimes you might see something on WhatsApp that seems interesting. It may be a funny cartoon, etc., and you may pass that on in jest, but fact check that bit of information. And also think about the fact that a lot of the vaccine hesitancy that we see, et cetera, is because persons are seeding doubt about things that have a strong scientific basis. So yes, COVID, the SARS-CoV-2 virus exists. COVID-19 disease in and of itself is a disease that needs to be taken seriously. And I think the other thing that I'm still getting a lot of is really that persons are thinking that because they're young, they're immune, and therefore they don't need to wear their mask. They can still lime on wherever they lime, they can still go down to the boardwalk or whatever and have their drinks, etc. And we're not keeping our physical distancing. We're not doing our hand sanitizing. We're not wearing our masks appropriately. But we want to say we can still affect transmission if we do these basic fundamental non-pharmaceutical interventions. So not to belabor the point, so everybody should be walking around with their little hand sanitizer. If you know there's a particular one that works for you, you like the smell, you like how it feels on your hand, you use it to make sure that you're not, reusing your disposable masks, etc., and that kind of a thing that we've talked about for a long time. So the other thing that I want to address is the role of the vaccine. The last thing I saw, which was, admittedly, I wrote a very strong text to the person to say, why are you still sending stuff about the vaccine not being useful? There is sufficient evidence that says that the vaccine is useful in its various forms. So I think that that's something that I would really want to implore persons. If you've not had the opportunity to sit down and to talk to your health professional or a person that you trust about being vaccinated as a way of minimizing your ability to spread COVID, or if you contract COVID, to decrease the likelihood that you would have a severe form of COVID, I would say have that conversation. It's not too late to have that conversation. and to know that the vaccines, how they're given in Barbados, they're given by particular schedules, and we have sufficient variation that you can find and choose the vaccine that suits you. And for us advocating, I would say advocating and not mandating, advocating for the use of the vaccine does not in any way marginalize or minimize the use of other things that strengthen your immune system and your immune response. So maybe we can have later on some of that content. So I'd be happy to share just general principles, public health principles about whether the vitamin D and the zinc and the vitamin C, et cetera, and the garlic and cayenne that everybody's coming into the office or whatever saying, we've made this and we're using this every day. You know, I would like to talk about that as well, how you could use those things.
I think one of the important areas here is palliative care. I want you to explain exactly what it is and how important is it within the context of what we are experiencing today.
Goody, thank you. Happy to talk about palliative care. So for everybody, palliative care really has to do with improving your quality of life. And it's about improving the quality of life of patients and their relatives. So it's dual clientele who face challenges associated with life-threatening illnesses. And what we have in Barbados is that we have a dual burden as it relates to palliative care. So we have lots of persons, we know pretty much the statistics, a significant proportion of our adult population, they have non-communicable diseases. The end result of these non-communicable diseases can result in life-threatening conditions. So you might be a diabetic. If you're not well controlled, you could have end-stage renal failure. You could have your heart being affected, etc. You could have stroke, motor neuron disease, persons with cancer, HIV. So where palliative care fits in, especially as it relates to COVID, is helping in the management and the optimization of persons' health so that if they do contract COVID, their outcomes will be better. But more importantly, if they're on a road to recovery, all of the systems that can be put in place to help you. So in palliative care, we operate on what we call a multidisciplinary team, and there are certain points. So we're always checking to make sure that any physical symptoms, and especially as it relates to COVID, any fatigue, any shortness of breath, any residual chest sprain, those kinds of things that you're managing. If your nutrition needs to be optimized, that you're getting help to design the appropriate nutrition package for you. If COVID can do a lot with your mind, just the thought of COVID sometimes, or the anxiety of maybe being in an isolation facility or a quarantine facility, there's a significant amount of stress that can happen. And then unfortunately, we do have a role in bereavement support. And the reality is that for many of us in Barbados, we can now count on our hands the number of persons that we have personally interacted with at varying levels of depth, so to speak, who have passed away as a result of COVID. It is now that. So it is, I was talking to my mom quite recently, and she spoke about the neighbor down the street. She spoke about her minibus driver, a friend of a friend, somebody from work. She's now retired. And so sometimes these constant bits of grief, we help persons to cope with that as well. So that is what palliative care is. And if you want to zero in on any of those particular things, if persons want to ask advice on any of those things, I mean, not generally, because I'm not interacting with you individually, I would be happy to do that. But that's what palliative care is. Yeah.
So send your questions to us here via WhatsApp at 256-1023. Here is a practical question.
Sure.
This is the kind of stuff that we get quite a bit. This person says, I got a COVID test on Monday. They told me not to leave home till I get back the results. And I ain't get them back yet. I don't have a biscuit nor milk to make tea. What should I do? I also need to tell my workplace something, because it's 3 days I home and can't leave home to get a doctor's certificate to send to work. What's the advice to a person in that position? Who's taking that?
Sorry, I'd like to take that, David. I think that is an excellent question, because it allows us to speak to several different things. So someone has been tested for COVID. Now, there are various reasons why people may be tested for COVID, but certainly if somebody has been tested because there has been a specific exposure to a known positive, or because that person has symptoms, then certainly the advice is that that person, the person who's been tested, should remain quarantined until the result comes back. So that's the first piece. Why are they being told to quarantine? It is likely either of those two: one, that they have symptoms, or two, that there has been a specific contact with somebody who has who definitely has COVID. So that's the first piece. The next piece is the receipt of results. Now, normally persons receive the results through an automated system that we have. Once the lab processes the results and they're in their electronic system, those results are automatically sent out to the email address that is stored in the system. Sometimes there are issues, as this situation demonstrates, and we would want, and we have provision for persons who find themselves in this situation to call the hotline, to reach out and to say, this is my situation. The hotline is in a position to, they have access to the results. They also have access to the results team. So the results can be shared verbally, the results can be emailed as they routinely are. So first piece, why are they being tested? Tying into why they're being told to quarantine. Then the issue of haven't seen the results. The results normally, we have been, and I looked at this yesterday, there's what we call the latency of test results. So how long does it take between the time a sample is officially received by the lab and when the result is available for email back out and emailed in an automated way? And all of our results for the past several weeks, I think, with the exception of one day when I think we had a problem with the software and the backbone of the system, all of our results are available either the same day that the sample is processed by the lab or within 24 hours. So if your test was done this morning and tomorrow morning you have not received the result, reach out, give us a call so that we can get your result to you. 99.99999% chance it is available, and we will make sure that you have it. And then the other piece is the issue of the employer. So between the testing site and the hotline, we can seek to provide documentation. In some cases, this is being done. Then once the result comes back and we're clear, the person is either being cleared and we're just documenting in terms of the day that they've been away, or the person then has to go into isolation, and then they need documentation in relation to that. And we're working with NIS to expedite the systems for ensuring that persons' claims are received and processed in an expeditious manner. So the other thing is certainly for persons who are in home isolation, we have a system, and if persons are quarantining and they have the similar issue, they can again reach out to the hotline. And what we have done is work with our partners over at Ministry of People Empowerment and Elder Affairs. They've made available to us a set of social workers who are assessing people's situations and facilitating assistance in etc. So this is in place sort of in an automatic way for persons who are in home isolation. But if persons otherwise in quarantine are having these kinds of issues, please reach out so that we can see how the systems that are in place can be made to assist. Yeah. So again, I would say excellent question, because it touches on a wide range of things that people need to know in terms of how do they navigate and what do things mean. Thank you.
Here's one that a family experienced with respect to getting a death certificate. The person went into isolation and came out of isolation, but the next day, the day after they came out of isolation, they died. That then raised this whole question of how could they get the death certificate? They became pretty frustrated because they went to the doctor that the patient had attended prior to going into isolation. And that doctor said, no, I can't give you the death certificate. That death certificate has to come from the isolation center. But up to this morning, they're saying that they are still awaiting the certificate from the isolation center. And they were being told basically that they were awaiting signatures. And for them, it is an issue of the slowness with which this whole process is taking place as they set about trying to, put closure to the whole experience. So share with us and other people in that situation, what is the process? What is the best that can be done?
Okay. Again, this is a very good question. I don't have all of the specifics that would allow me to speak to this particular situation, but what I would say in general is, if someone is having a delay in terms of access to a death certificate for someone who had COVID, they can make contact with the office of the CMO. I would actually recommend that they write to DCMO, that's Deputy CMO, at health.gov.bb, so that the matter can be looked into, so we can see how we can of deaths in the setting of COVID has become a little more complex than would normally be, because there are issues around determining cause of death. And so there may be interaction between the coroner's office and other parties in terms of determining whether there's need for an autopsy, etc. So I would recommend in this case or in similar cases that persons write to the office of the Deputy CMO, dcmo at health.gov.bb, and we will see how we can assist.
Dr. Greaves, there is a worry too about people who have COVID and then have to live with a range of other issues after they've had COVID. And the question here is, what's the best that can be done for those people? What's the advice you give to those people? And many of them, and let's be realistic about this, a lot of these people do not have money. COVID itself has put people out of work. It is really impacting on poor people more than anything else. So for the person who doesn't have the wherewithal, what's the advice there?
So I think one of the first things that persons can reasonably do is to start to know their bodies. And if it is that they are wherever they're usually accessing their healthcare, long COVID technically is something that should be managed or could be managed and facilitated by any general practitioner. So if it is that they're usually attending the polyclinic, if it is that they are they have a general practitioner, usually when you're discharged from any of the isolation or quarantine facilities, there's usually a little note that accompanies you to say, briefly, some kind of outline of what could be done. But the first thing is to know yourself, yes? So to know those main symptoms that could continue. So for example, shortness of breath or the inability to smell, that may take at least about a month or so. But I'm very concerned about the shortness of breath, cough, and chest pain, yes? So for persons who have these symptoms, but they notice a change or a worsening, So say, for example, if you are accustomed to walking a certain distance and you're becoming more short of breath when you walk the same distance or with minimal exertion, that is a point where you need to trigger access to healthcare, because it may just not be quote unquote COVID. It could be a post-inflammatory situation. Just let me break that down. So for some persons, if they have underlying asthma, sometimes you might be talking about inflammation of the lining of the lungs. You may be having a situation where, very common in Barbados, you are over 40, you may have fibroids, heavy period, etc., might become a little anemic, and you get the same shortness of breath. So what we want persons to be is to be aware of when a change is occurring. So once you recognize a change is occurring, the appropriate assessment can be done. Now, what's happening because of COVID, a lot of physicians are opting to do what we'll call remote consults. So consults that may be on the telephone, or for persons who may have internet access at home, remote consults that may be via a low bandwidth platform like Zoom, etc. So the first thing to do is to know your symptoms, know the change of your symptoms, and trigger any necessary support. So that's related to shortness of breath, because shortness of breath could indicate any myriad of things. Chest pain as well. If your chest pain, if you know the location of your chest pain and that chest pain is changing, that also should signal that you need to trigger some help. It may not necessarily only be COVID. So particularly, I think everybody knows about the chest pain that, radiates down the left arm or runs down the left arm or up to the jaw, etc. That might signal, maybe some pain that might be originating from the heart region. But if you have chest pain that is radiating from the front of the chest and going right through to the back of the chest as well, that's also very important to make sure that somebody is aware of that. Or if you have chest pain that might mirror what persons would usually call reflux. And this is a diabetic who is also post-COVID, and you feel that chest pain coming up the center of the chest, that's something that we also want to know about. So I would say to persons, don't panic, have your little book where you are monitoring yourself. If you notice any changes, contact the person who usually sees you. If you don't have access to that individual, you always have access to the emergency services. Be open to the fact that we can no longer visit doctors as much as we want to in person, but you can still have a good service provided via telemedicine. But I would say know yourself and know those 4 major symptoms that can occur post-COVID.
This person writes to say that they're recovering from COVID for a week and a half now, and they're back home.
Yeah.
But they seem to be having side effects now that they're at home. Okay. They say that the ears lance them and their feet are shaking so much that they can't stand on their own. And also, the tongue has been talking funny at times. I must mention that I was on heavy oxygen for 5 days. Could that be the cause?
No, I would say no. I think the important thing is there are 3 constellations there that definitely say to me that this person needs to get checked. I don't know their underlying conditions, but the fact that they're saying that their tongue, quote unquote, seems to be talking heavy at times signals to me that there may be something going on with the nervous system, and that needs to be checked out as a matter of priority. Because anytime you are noticing that you're not speaking properly, or you're not speaking clearly, or your tongue feels heavy, or you're having difficulty swallowing, etc., that signals sometimes a change in the way how the nervous system is operating. Likewise, if you're having difficulty standing, yes, COVID can cause extreme fatigue, and your muscles may not feel as strong as they usually do. But if it is that this weakness in the legs is also accompanied by pins and needles, or if the person is a diabetic or they're hypertensive, I would definitely say that they should get checked. And if one part of the body, one limb of the body feels weaker than the next, they should also definitely reach out to their service providers for a review. Yes, that's very important, because sometimes there's some nerve things that can happen after COVID, and I would want that person to be checked. It does not directly relate to the oxygen, which was their question, the hypoxia that needed the oxygen.
I also draw to your attention, doctors, that people can go through a process of denial. I had a friend who said he has a cold, I said, a cold? Well, I don't know the last day anybody around here had a cold. It turned out that he tested positive for COVID. And that brings us to looking for some of these signs that you need to go and get tested and to address this question of, so if it's mild and I believe I got COVID, why is it necessary for me to get a test anyway if I can stay home and self-isolate and I don't seem to have a problem?
Arthur, I think you should take that one in the first instance, and then I'll come in.
Thanks, Natalie. No problem. So in short, we are encouraging persons to get tested and to be part of the formal systems, really for two reasons. One is for their own benefit, for their own protection, in terms of definitely knowing if it is COVID. It may not be COVID. It may be something else that needs to be worked up. It may be something else that there may be a difference whether an intervention is made or not. So one, people need to be tested because knowing that they have COVID and them being part of the formal systems will allow them to be assessed in terms of risk of negative outcomes and increase the chances of them being able to have good outcomes, because they'll as they're risk ranked, they will be dealt with in terms of whether they're green and can stay home, whether they're yellows and should go for assessment, whether they're reds, so first piece. The other piece is for the benefit of others. If I am definitely positive, then actions can be taken by myself and by others to reduce the risk of them getting it from me, so to reduce the risk of spread. So those are really the two reasons. We have, and just to go back to the first piece, we unfortunately have had persons who have had what they thought was mild COVID in situations where they felt that they were fine and they didn't have an issue. And then you can have a situation where they have significant symptoms and we may not be able to do all for them that would be ideal because we are playing catch up. And therefore there's an increased risk that they may not have the sorts of outcomes that we would want. So I would certainly encourage persons to be tested. Yes, some of the symptoms, many of the symptoms that are associated with COVID are common symptoms and may be associated with other illnesses, viral and otherwise. But it is useful to have that information and engage with a system that can provide appropriate support if
Dr. Greaves, you wanted to follow up on it?
I just wanted to perhaps emphasize the last part about what Arthur was saying with respect to catching up. I think that there is a very useful graph as it relates to cancer in particular, how the disease progresses. And COVID can be quite similar in that you are at a steady state and you're doing quite well. But if you should decline, the decline is a very steep and rapid and sudden one. And I think a lot of persons, including young persons, take it for granted that should you become unwell, you will be able to activate the necessary services fast enough, and that the services will be able to facilitate you and help you without your body sustaining too much damage or compromise. So I think for the person who is out there, I just want to be very frank, because I don't think we really have a lot of time to play around with. There are people who will sometimes use COVID to their advantage. And they will say to you, you don't have to get tested. They could say to you, you don't have to get tested. I know that you have every single thing that that matches COVID. Don't get tested. Don't get into the system this or the system that. I will monitor you. And then when the rubber meets the road, people are struggling. I would say to Bajans, use your head. Do not put yourself in a situation where you are not accessing the best available care for COVID. If it is that you are proven to be COVID-19 positive, there are systems in place. Arthur mentioned, and perhaps he will go back to what that actually means. Perhaps even if there are deficits or defects in the system, there are systems in place to assist you with monitoring. And if you are also tied to a health professional who can help you and guide you and also trigger services at the appropriate time, I think that's extremely necessary. So I think people will remember this. You remember you said earlier, David, that someone was talking about a lancing pain that was going up the side of their face. Something as simple as a lancing pain could be so many different things. That could be, worst case, one of the scenarios, it could be an infected nerve root of a tooth. It might just be a tooth. It could be inflammation around one of the arteries on the side of the head. It could be a fluctuation in the blood flow to the brain. Some persons may have something as simple as dizziness, and they may automatically assume, oh, my sinuses are blocked, or I'm having vertigo or something like that, but it could be something else. So I think what we're saying is to tie yourself to the most appropriate service that will help you to monitor yourself effectively. And I think that's the main message, not to take for granted that you understand all of the symptoms of COVID and what they could potentially mean.
This one is, what are the protocols, or what is the protocol for persons who had some contact with a COVID positive person? Does the contact of the positive person wait for 5 days and then test? Or do they test immediately, and if negative, go back out to work on day 2, 3 of the exposure? 2 people are calling and asking for their working children, and we need an answer. Thank you in advance. Arthur?
Yeah, I was looking at Natalie, no problem. So the short version is that we recommend testing at 5 days, or more after a known contact. But I want to speak to what we mean by a contact or an exposure. We have traditionally used, and we still formally use, the idea of an exposure around the idea of, one, we talked about the fact that the person that you're interacting with is known to be positive. So we're starting there. And then 2 is, what is the nature of this interaction? So we're talking proximity, we're talking time, we're talking level of protection. Those are 3 important parameters that help us to get a level of, an idea of the level of risk of actual exposure. So the longer the time the interaction took place, the more the risk. The closer the interaction, the more the risk. The fewer areas of protection that were in place, the more the risk. So the rule of thumb that we use, and some people argue that this is not as sensitive or as cautious as it could be, because we're now dealing with Delta, which is more contagious. But the rule of thumb that we use is 15 minutes over a 24-hour period, less than 6 feet, without a mask. That's the rule of thumb that we use, because that would constitute a significant exposure. So if Natalie is interacting with me and I don't have on a mask, she doesn't have on a mask, we're less than 6 feet apart, and the interaction is more than 15 minutes, then, and I'm positive, then there's every probability that she has been exposed. Now, the 5-day period in terms of the test has to do with how long it takes after you've been exposed before COVID will show up. So in the vast majority of cases, by 5 days, if someone has been exposed, they will test positive. So that's why we say at that point. So the issue is, in some cases, and again, this is an excellent question, you have cases where individuals find out that they've had an exposure. Oh, Arthur is positive. Oh, I was with him yesterday. So I run down to the gym or Brantford Tate or Eunice Gibson or Urgent Care or one of the other testing sites, and I get tested today, and I'm negative today, and I go back to work tomorrow, but then I actually seroconvert. I'm actually infected, infectious in 2 or 3 days, and then I can spread to other people, but I have this inappropriate or false sense of my being negative because I took the test too early. So persons should test at 5 days or later after the last known significant contact. Yeah.
But Dr. Phillips, the extent to which the challenges that they face with getting documentation, to what extent is that likely to make it difficult for people to make the choice of going into quarantine, for instance? Because if you go into quarantine, you spend time waiting in quarantine, then you go and get a test after that. You're supposed to get 2 tests. And after that first test, it comes back negative. What's going through the minds of many people is, but look how much time I'm losing from work. Am I going to be paid? To what extent does that really feature significantly in creating problems for people in that situation?
Yeah, what we're finding is that most persons are very responsible, and this is refreshing. However, there is a significant minority of persons where persons in taking into account the reality that you've spoken to, being away from work, having questions about income, etc., and documentation to support compensation. Some persons are inappropriately going back to work. Now, 2 things. One is returning to work with the negative test. Certainly from our discussions with the employers associations, our understanding is that they are, for certainly the ones we've spoken to, are accepting that as documentation, appropriate documentation. There is a level of faith that employers are having in their employees in the context of all that has been happening. Yes, individuals may choose to go and specifically get a back to work certificate, etc., to return to work. But having informed the employer, I had a specific exposure, I'm doing an initial test, or I'm waiting the 5 days and I'm going to do the clearance test. I believe that most employers are giving favorable consideration to that kind of situation, understanding the wider context. And as I said, given the discussions that we've had with the employers associations, that's the impression that I have. So the 2 pieces: one, that people are being responsible in the vast majority of cases, and 2, that employers are being considerate and supportive, again, in the vast majority of cases.
Do you want to add to that, Dr. Greaves?
Yeah, I just wanted to revisit an important thing that Arthur said in terms of the rule of thumb. I think the rule of thumb is that everybody should kind of try to adopt that. Try not to be in a space that has, especially poorly ventilated, where you are in contact with someone for more than 15 minutes without some layer of protection, in particular, in this case, your mask. So I think persons need to think about, where do I encounter that every day? And the most commonplace persons will find is probably around the lunchroom area in the work. So you have to think about how will you operate your lunchroom space, or how will you navigate your lunchtime? And also, after work limes, etc., where people stop to lime, or if you are, especially eating and having a meal with someone, I think that's extremely important. When am I going to be around the person for 15 minutes or more without wearing my mask? etc. And that's what I wanted to add in there. So we have a responsibility to minimize our risk as well, or to manage our risk. Yeah.
People hear about the clearance certificate. What is the clearance certificate? What's the difference between that and the yellow paper that people get from National Insurance? Dr.
Okay.
Phillips?
Yes. So both from the isolation facilities team and from the home isolation team, individuals are receiving or should be receiving documentation on discharge from isolation. The yellow paper, I say in inverted commas, is the legally mandated documentation for submission to NIS. By law, it is supposed to be completed by the healthcare provider, a section of it, and by the client, another section, and then submitted to the NIS within 4 days of the person being away from work. That's the legal piece. We are in the process of working with NIS to see how we can facilitate some other arrangements that we believe would be beneficial, that would meet all the documentary requirements of NIS, but would significantly reduce the administrative burden, particularly on the home isolation team. Currently, they are issuing a discharge certificate to everyone who has been in isolation. And they said we're working with NIS to ensure that up-to-date documentation is available for all persons who have been in who have been in isolation, so that they are able to receive the sickness benefit that they are entitled to. Yeah. So the two things are separate, but they come from the same place, and we are seeking to put an additional system in place to make it faster and more responsive.
Okay, the question of when does one take the vaccine has come up quite a bit. How long after I contract COVID will it take for me to take my first vaccine? That's one of the questions.
Yeah. So unfortunately, we do have situations where persons who may be at increased risk are not yet vaccinated for whatever reason, and after they have been cleared, they can certainly be immunized. There is a benefit to them being immunized. The protection that having had COVID gives wanes over time, and therefore we have made provisions for persons to be able to have their vaccine a month after having had COVID, after having been cleared of having had COVID. There are settings in which this may take place earlier, but the current policy position in Barbados, current operational position, is we're offering it as early as 1 month after having had COVID. You can get your first shot.
So assuming that I had my first shot, but I caught COVID in the intervening period, how long after that would it take for me to get the second vaccine?
Right. So that's an interesting one. So that then brings into play the issue of spacing between the vaccines. But certainly once there is adequate spacing between the two vaccines, the second shot can be given a month after the person's been cleared.
Dr. Greaves, you wanted to add anything to that particular area of questions?
I was just saying that, just to go back, doubling up, not exactly to that question, but I've had a couple calls with persons wanting to find out if they could have their AstraZeneca vaccine second dose brought forward. is so that it matches more like the dosing program of the Pfizer vaccine. I just want to encourage persons to stick to the dosing schedule that works for that particular vaccine, and to know that AstraZeneca's second dose is not given around the 4-week period, but preferably between the 8 to 12-week window. Yeah, that's what I wanted to emphasize there.
This person says that we're always talking about wearing our mask correctly, but no one is speaking directly about the type of mask to be worn to properly protect us. We know that not all are equal, and disposables are only for one-time use, although people wear them over and over, even washing them and re-wearing them. In their judgment, that is why some people are contracting the virus, even though they're wearing masks. Let's discuss that. The quality of masks.
What I would say to this question is there is certainly research that looks at the types of masks and the effectiveness. So, for example, in the healthcare setting, where individuals are interacting with, say they're in a isolation setting, or in a setting where they're doing swabbing of persons who may be ill, who may be likely to have COVID. In that setting, we recommend well-fitted masks, N95, in that setting, if they are doing procedures on persons. If they are just generally interacting with them with other infection prevention and control measures in place, they can actually wear a well-fitting surgical mask. So yes, the type of mask used can affect the level of risk of exposure, and then there are issues around risk of exposure that just have to do with the setting in which you're operating and how you're operating. Ideally, as you have said, as intended, disposable masks are supposed to be disposable, and over time, a mask may lose some of its effectiveness if it is reused, although it was not intended to be reused. So we would encourage individuals to take good care of their masks. At the end of the day, we are talking about layers of protection. We've talked about vaccines as a layer of protection. We talk about masks as a layer of protection. We talk about distancing. Natalie would have mentioned the issue of ventilation, the hand hygiene, and the other measures. These are all measures to reduce risk. And as many measures as someone can have in place, with whatever is the ideal that they can attain, that will help them to lower their risk. So if an individual is able to get N95 masks, that will give them a higher level of protection than a surgical mask, a well-fitting surgical mask versus a surgical mask versus a cloth mask versus nothing. A cloth mask with 3 layers or more, different kinds of cloth. Individuals can look up this. This is quite interesting point of discussion, and individuals can arm themselves with information on the various kinds of masks, how they may be able to make their own masks, for example, and how best to do that in a way that can maximally reduce their risk.
One of your colleague doctors raised an issue of Johnson & Johnson. This is the one jab. And they report that going to administer this jab to the elderly in particular, they're encountering a situation where people are saying, but why am I getting one jab when other people are getting 2? And there's an assumption that everybody knows about the difference between Johnson & Johnson and AstraZeneca and Pfizer. So to that extent, the question really is, how can this be overcome? What can be done about this? Because it looks as though for those people, not enough information has been given to them.
So, David, I feel like if I'm always saying I want to talk about something that was just covered, but I just want to, and then Arthur, you can probably prepare for the vaccine question. So the issue of the mask is extremely important, just because the basic mask and the respirator type mask, like the N95, are totally different. And I think if persons, as Arthur would have hinted, if you're making your same cloth mask, you want to make sure that that's, 3 layers deep. The innermost is something made of cotton. The outer is something like polyester. I'm just saying this because I want to share a link as far as possible with the audience. There are specific guidelines on how you should use the mask and what the mask should be made of. So the surgical mask, usually what we will call the medical mask, they are usually 3 layers thick. And for if you are taking care of your granny who's at home, or you're taking care of anybody who's immunocompromised or providing care for the elderly, etc., those are the kinds of masks that you should be wearing. If you are over the age of 60 and you have a medical condition, an underlying medical condition, when you're moving out and about in the general public, that's the mask that you should be wearing. So if you are 78 years old and every Tuesday and Friday you go to town to shop or whatever, you want to stick to that routine, you're not going to town wearing your cloth mask. You're going to go to town wearing your surgical mask. That is the best protection for persons who are over 60 and those who are under 60 with underlying conditions. So the link that I want to share, I don't know how, but I'll put it in the chat here. It's from the WHO, and it has a lot of information, very useful, accessible information that can guide persons on the use of masks. And of course, if you're going to be in prolonged contact with somebody who's extremely vulnerable and you are a healthcare professional, you want to think about wearing your respirator type closely fitted mask along with something like a face shield as well. And that's what I wanted to add on. And I'm just going to hand over to Arthur.
So then there's the Johnson & Johnson question.
Yes. So Johnson & Johnson, as you would have flagged, is different in that what has been approved is a single dose. The figures may vary slightly, but the very large studies that have looked at the effectiveness of Johnson & Johnson suggests that the single dose gives about 75% efficacy against severe or critical COVID-19 infection. And this has been fairly consistently seen across age groups and across countries. In terms of protection against hospitalization, that was about 89%. And in terms of protection against COVID-related death, about 83%. Now, the reality is that a booster or a second shot of Johnson & Johnson has been shown to give additional protection. So, for example, one really large study looked at second Johnson & Johnson given 2 months later, and individuals got 94% protection. Now, let's step back a second. 75% protection, while not being the highest level of protection that a vaccine can give, is comparable with some 2-dose vaccines. Yeah. So I think individuals, the discussion around the vaccine and its effective, the vaccine and how many doses and how does it compare, I think should be a discussion around the effectiveness of the vaccine in protecting the things that we're interested in. Severe illness, hospitalization, and negative outcomes in terms of severe illness like death. And a single dose of Johnson & Johnson actually does that well. Yes, a booster does it better, quote unquote, but a single dose of Johnson & Johnson is actually comparable with or just a little less effective than many of the approved 2-dose regimes.
This question is, when a person is exposed to a positive COVID case, just confirm the length of time the person has to quarantine for and confirm that they need 2 tests. In addition, confirm that this info is told to such persons when they go to the clinics, etc., for testing. Also, is home testing available for the elderly? My mom is in her 90s.
I'll take the last part first and then hand over to Arthur.
Thanks, Nat.
Yeah. So the home testing is available. Is what we want to say? Through the Ministry of Health, you can have home testing not only for persons who are elderly, but also with arrangements with the polyclinic. You and the Ministry of Health mechanism, and Arthur could speak further to that. There is a shut-in type service, so for testing, but also for vaccinated persons. So I just want to take this opportunity also to publicly thank the Ministry of Health, because I know I have had patients who have been unwell and who are not in a physical position to go out and get these things done, and that has been facilitated. Yeah. So over to you, Arthur, for confirming the dates and times.
Thanks, Dr. Greaves. So I want to touch on the issue of home testing and then go back to the timing for testing after exposure. Home testing is available in both the public and private sector. There are some limitations in terms of capacity in the public sector. So it is important to communicate exactly what the situation is when engaging to say, I would want someone tested. But we do have, and we've recently expanded our mobile testing team capacity, but it is not unlimited capacity. So if we receive 50 requests at the same time, we may not be able to honor all of them immediately. There may be some delays in terms of getting to persons. But yes, Ministry of Health does try to offer home testing, particularly for vulnerable persons who may not be able to get out, particularly for groups of vulnerable persons. So where there are, say, nursing homes or care homes with other persons who may have limitations, and there's a positive case or known exposure, or mobile testing teams are asked to prioritize those settings. So that's that piece. In terms of the test, so I did hear they confirmed that 2 tests are required. 2 tests are not required. So I want to say this clearly. I'm trying to remember which US president it was said, read my lips. So 2 tests are not required. 1 test is required, which is the test at 5 days or greater to clear. There is a benefit to having 2 tests, but 2 tests are not required. What 2 tests allow us to do is to have a sense of what may be happening now, particularly when the exposure may not be a point exposure. A point exposure, let me back up. A point exposure may be, I don't normally interact with Johnny, but I interacted with Johnny yesterday, and today I am known to be positive. So there was an exposure at a particular point, and then we can test at that point or 5 days later. Fine. And ideally, if we're only going to do 1 test, and in most cases we may, that test needs to be 5 days or later. Now, situations in which we tend to support or encourage 2 tests are situations in which the particular exposure may be unknown. So you're talking about individuals who work together, and we're not exactly sure at what point an individual may have become positive, but we've picked them up as positive now. But there may have been interaction over a period of time, and therefore the exposure may not just be on the last day that they were at work, but the exposure may have been from the time they were infectious, which may have begun several days before. So a test what a test now allows us to do is to get a sense of if there may be spread in say, a workplace setting, for example, and if there are other people who may be exposed, and to be able to follow up in terms of some of that contact tracing. And we've certainly with the workplace guidance empowered employers to be able to support some of that. So 5-day test, that is the test that is required. A test before, desirable, particularly in settings in which there could have been prolonged exposures, and therefore we may be able to pick up additional persons by testing earlier as well as testing later, because there may have been exposure before the last day this person was in the particular setting. The other issue that was asked was around, that was the home testing for elderly persons. So yes, that we answered that. Yep. So great.
Thank you, Dr. Arthur Phillips, Senior Medical Officer of Health, and Dr. Natalie Greaves, Lecturer in Public Health at the University of the West Indies, General Practitioner and General Palliative Care Provider. I want to thank you both for coming and sharing your time and your advice with the public. I hope that you've been able to cover a wide enough base of some of the questions that people have been asking. And we look forward to having a similar exercise in the future, if not with you, with some other of your colleagues. So let me also thank the technical team for supporting us today, and those of you who participated as listeners and as viewers. And David Ellis, do have a great day.
Thank you.